Hey everybody, just wanted to do a quick video on neck pain. We've gotten a lot of questions for people to help them understand why they're having neck pain. So we're going to go over the common causes of neck pain, why it happens, and then we're going to go in and show you just a quick demonstration of some of the techniques that we use to be able to help people decrease headaches and pain from stenosis, degenerative disc disease, herniated disc, as well as headaches. So headaches is a very complicated one, and it's not always just orthopedic, and what I mean is sometimes you can get tension headaches and things like that, and we're not going to go into that side of it if you're going to a neurologist, but we do get great relief from positioning headaches and things that position change and can increase the pain or episodes with headaches. So this is the C-spine. This is a vertebrae. In between the vertebrae is a disc, and each disc is supposed to be sort of like a grape that is a fresh grape, and as you age, that grape becomes more of a raisin, and in between each of the vertebrae, and here I've just written C1 through C7, and obviously this person has a very straight neck, but just for some regular anatomy, this area right here is a very fibrous sheath that covers the spinal cord, and so it's very difficult and doesn't happen often that goes into there and penetrates. Now what it will do is come out to the side, and what does that is typical that it does that more between C2 and these other vertebrae, and that's called a disc herniation. And it herniates because you're forward, and when you do something, the disc can't go backwards, so it goes to the right or the left. And when it does that, then it presses on the nerve, and the nerve goes down your arm. So you'll get nerve pain, tingling, or numbness that can happen, and it can come or occur at any of these vertebrae, and it's just dependent on what position you're in. Now, just for anatomy's sake, each one of these has a nerve coming, and it goes down the arm. So, vertebrae, disc, vertebrae. Now, typical problems are arthritis, degenerative disc disease, and stenosis. We're finding this to be occurring in the early 30s with the arthritis and the degenerative disc disease. And what that is, arthritis is sort of a buildup, gunk, shall we say. It's bone that grows in between the vertebrae, and the vertebrae, if I'm a vertebrae and I'm this way, it has transverse processes, and for a neck you're supposed to do this, so you're turning left and right, you're supposed to side bend, and you're also supposed to be able to go forward and go back, retract. Okay, so when you have this growth, which we call arthritis, in there, then the motion locks up in between C1 and C2 vertebrae. And what we're finding is in between the C1, C2 vertebrae, and then Maddie, if you'll step over here, let me just show you. Maddie actually had some back and neck pain. And then right here is T1 through T4, and then you've got the rest of the thoracic spine. So way up here, these top two vertebrae are C1 and C2, and if you have arthritis, it doesn't rotate. So if it doesn't rotate on these two, these other, which are C3 through C7, because of posture and a forward head, and just slouch like you normally would before therapy, this goes forward, and when this goes forward, then you're pinching on the nerves in there because the vertebrae are stacked in this way, and they're moving freely. This is not moving up here. These are not moving. So all of your pain is coming from C3 through C7, and typically you'll get headaches from that. You'll also get numbness, possible tingling that's going to go and radiate down your arm, and that's due to a pinched nerve in this area. Thanks, Maddie. A herniated disc would be sitting on that nerve, and so it is out the side here, and that nerve comes out, so it's just sitting on that nerve. So that's just like you're just taking something on top of a water hose or a garden hose, and you're kinking it, and when you kink that, then that's the area that you're going to have pain. Now, degenerative disc disease, so you've got a disc that is supposed to be like a grape, but because of aging and deterioration and arthritis, this, and because of standing up all the time, the compressive forces between the vertebrae actually cause the fluid to dry up, and so this is more of a raisin. And so you've got those compressive forces of standing up, shortening that, and this raisin, it just doesn't allow enough room for that nerve, so you're pinching on that nerve because there's no space like there's supposed to be in there. Now, stenosis. We're seeing this at like 35, 36, 37, and older, of course. And this is when these are locked up. You've got degenerative disc disease, and this little space that's left between the spinal cord, the disc that's now compressed, there's a little foramen. And right in here, there's a narrowing, and with that narrowing, you're just pinching the nerve. So it just seems like no matter what you do, going forward, back, whatever, you're in extreme pain. So, again, these are locked up. C3 through C7 are actually being pounded on. It's sitting on those nerves, and pain is just constantly aggravating you. Typically, what we hear from people is anytime they're sitting, standing, walking, there's numbness in their arms, tingling, and also some heaviness that occurs. So why do you have this? Well, you have it because there's degeneration and there's arthritis buildup. You've got it because there's narrowing in here, and because of posture, cell phone use, computer use, and rounded shoulders, your head is in this position here, and when you're in this position, it's just banging on this C3 through C7. So successful treatment, you've got to go in and you've got to create movement between these vertebrae that used to move that are no longer moving. And to do that, we recommend a treatment with grade 4 mobilizations. We do not do neck mobilizations here at Stretch, but we do grade 4 mobilizations, followed by turning back on the muscles that are supposed to be working, and then restabilizing the shoulders, the upper thoracic region, as well as the neck region. So we're going to demonstrate and show you some of the techniques that we use here in the clinic. Grab that. We're ready if you guys are right now. All right, so Stacey's just going to demonstrate what we look at and some of the techniques we use for neck pain. Actually, let me say that first. Stacey, we talked about stenosis, arthritis, degenerative disc disease, and a herniated disc. So what we want to do now is just kind of show them what a grade 4 mobilization is and sort of some of the techniques we use and how gentle it is.
Okay, so with assessing, just make sure we check motion first to see what's available for the patient to do. So we have them look over each shoulder. Right, that's tight. Left, Nathan needs some work. Again, a couple other directions. We have them side bend their head a little bit, one side and then the other side. See where the restrictions are and where we need to focus. Then if we're going to get into the treatment techniques, let's have you on your stomach first. All right. So my back would be to you normally, so I'm going to go off to the side just a little bit here. But we get you positioned comfortably, and then what I do is just kind of expose the area here. So let's say, for instance, Nathan here had some restrictions in the lower cervical area. What I would do is just using pressure of my thumbs, just kind of get right alongside the spine, and just apply some gentle pressure down towards the floor. Nothing overly aggressive, and just hold that pressure for a few seconds, then release it, and again, work those restricted areas until I feel like it loosens up. And then we just work our way along the spine and just address those areas that need to be loosened up. If some areas are moving fine, we skip that, move on to the next spot. So then a lot of times we have to get into the upper cervical right by the base of the skull, because that tends to be pretty tight. So again, exact same technique, just applying some pressure, gently pressing down towards the floor and holding that for a few seconds, getting those joints moving. Some other techniques that are really helpful that are done with the patient lying on their back. So let me have you flip over. Can we move this to the side? Because I'm going to do the stuff. Okay, so again, often we find that the upper cervical area is pretty restricted, so there's some really great techniques we have to address that. What we do is just gently grab her on the back of the head. We're going to lightly press down just a little bit, and then I just glide the head over to the side, kind of test the motion there, and then I glide it over to the other side, test the motion there. Nathan's tight. He needs this done. So we use the muscles to help us out with this technique to get things to move. So what I would do is just gently glide to the side again, and then Nathan, let me have you gently press your head to the right here into my thumb. Hold that pressure, and then relax it. And then I just take up that slack a little bit, glide it just a little bit more, and then have him press again. Good, and hold that, and then relax, and then we just, again, glide just a little bit further, and then press again. Good, hold that, and then relax, and glide just a little bit more, and that's it. Hold that pressure, and then we bring it back. So then I would do the exact same technique to the other side if it needed to be done. So another way we can assess, again, that upper cervical area, we just gently flex the head up, and then we're just going to do a little rotation, see how well it's moving that way, and then we're going to see how well it's moving that way. And Nathan's actually pretty good here. It doesn't have really any restrictions, but for instance, if you were tight, rotating this way, we just go to that motion, and then Nathan, you're going to gently, you're going to use your eyes and look to the left, and hold that. That just activates certain muscles that we want to help us get some motion. Go ahead and relax. Then we just take up that slack a little bit and then look to the left again. Hold that. And then relax. Again, take up the slack. Okay? So those are some great techniques we have to address some tightness in the cervical area. Another area that we look at that's commonly involved with neck pain is actually your first rib. And first ribs, they kind of sit behind your collarbone. Are supposed to. Sometimes they're pulled up higher than they should be. So we assess that by kind of getting into the top of the shoulders here and pressing down. And Nathan's a little bit high on this left side here. So I'm going to do it on the right side just so you can see. And then, well, that would be in sitting. So let me have you go ahead and sit up. So we're going to see if we can show that he has some tightness there, and then we're going to do the technique. There we go. All right, so you can sit up nice and tall. And then I'm going to have you look to the right. And then we're going to try to tip your head forward, this ear towards your chest. Okay, and then come on back up. So he should be able to move further than that. We should be able to drop the head forward more than it's going now. Let me test the other side too and see. And this side should be a little bit better. And it is a little bit better. Okay, so now we're going to go ahead and get you lying on your back again. All right, here we are. Okay, so to do the technique, and again, I'm going to show on this side just because it's the side of the camera, but then I'll do the other side too. Just get my hand positioned in here. I'm going to gently press down. So we're basically just trying to push that first rib back down. We're going to roll the head just a little bit and just apply that pressure and just hold that pressure for a few seconds. And then we're going to relax. Sometimes we'll add in a muscle technique with this too, where we're going to push, and then I'm going to have Nathan try to gently press his head into my arm. Nope, by the way. There you go. And hold that. And then relax. And then we just, again, kind of take up the slack there. So press again. Good. And hold that. And then relax. And just take up that pressure, or that slack. All right, so now I'm going to work his other side. So we'll do the same thing. So just kind of press and hold. And And then go ahead and push into my arm. There you go. Hold that for a few seconds. And then relax. And then press again. Hold that. And then relax. I'll do one more. And press. Good. And then relax. Okay. All right, so now we're just going to see how we're moving here. Okay, so now Nathan's going to sit back up again. Yes, down this way. Okay, I think we're good there. All right, so now we're going to have you look over the right shoulder, and that just automatically right there, that's better than what it was. And then we're just going to tip you, and you can hopefully see that he's going further in that direction. So just by loosening up that first rib, we're able to get some better motion in the neck. Okay.
All right, everybody, that's just a little bit about the techniques that we do here at Stretch Physical Therapy. If you have any questions, please visit our website or give us a call if you would like some more information. 513-874-8800.